A 52-year-old man is rushed into the emergency room after a high-speed car crash. He is hypotensive, tachycardic, and looks pale. Also very anxious. Now, upon physical examination, you hear muffled heart sounds and his neck veins are bulging. What is the diagnosis? Cardiac tamponade. That's what we're going to talk about in this video. If you're a medical school student, just like myself, this is a very high yield concept we should know for the USMLE exam. And just to mention, this video is just for educational purposes only. Okay, so let's break it down. The Beck's Triad. There are three key factors we should know when it comes to this condition. Number one is hypotension, and the reasoning behind that is that the stroke volume is going to go down and the heart is going to also have a muffled sound because of the fluid insulating the heart. And number three would be the jugular venous distension, that is there because of impaired right heart filling. Now, these findings point toward cardiac tamponade. And one of the things that we want to know for testing is that this results in a reduced cardiac output and also an equal diastolic pressure, which is classic but not always present. Now, when we get into the physiology in tamponade, the fluid builds up rapidly in the pericardial sac, and this raises the intrapericardial pressure. The heart cannot fill properly, and then the stroke volume is going to go down. First, the right atrium collapses because it has the thinnest wall, and then afterwards, right ventricle filling is also restricted, resulting in a decreased in preload and output. And eventually, this causes obstructive shock and cardiac arrest if not treated. I also want to point out that pulsus paradoxus can also be something that we should note, resulting from cardiac tamponade, which is a drop in systolic blood pressure more than 10 millimeter mercury. Now, regarding chest x-ray, as you guys can see in this picture over here, we got a water bottle sign. And also when it comes to the ECG, the electrical alternans are evidenced by alternating amplitudes of the ECG. So basically the QRS complex is varying, the voltage is varying. When it comes to echocardiography, we can see pericardial effusion in the right atria. Echocardiography is the gold standard diagnostic tool that you want to have when it comes to cardiac tamponade. When it comes to treatment, we got ultrasound-guided pericardiocentesis. While preparing, give IV fluids to support the preload. This buys us time but does not treat the cause. So pericardiocentesis is needle drainage of the pericardial fluid, and it's a life-saving procedure. And for recurrent tamponade, we should consider pericardial window surgery, especially in malignancy or TB. We should also treat the underlying cause, such as cancer, TB, or uremia. Note that in pericardiocentesis, a needle is inserted under ultrasound guidance, most commonly via the subxiphoid approach directed towards the left shoulder. Alternatively, the parasternal route may also be used. Fluid is also aspirated from the pericardial sac, relieving the pressure on the heart. It is life-saving and must be recognized and performed. All right, so we got a clinical case quiz here, which is a 68-year-old woman with a history of metastatic breast cancer presenting to the emergency department with a progressive shortness of breath, fatigue, and chest discomfort. Now, on a physical exam, she appears anxious, mildly confused, and her blood pressure is low. Pulse is 118 per minute. Respiratory is 22 per minute, and JVD is also noted. Heart sounds are distant, there's no peripheral edema. ECG shows sinus tachycardia with low voltage QRS complexes and electrical alternans, and a chest x-ray shows a large globular shaped cardiac silhouette. The point of care ultrasound reveals a large pericardial effusion with diastolic collapse of the right ventricle. Now, here are some follow-up questions. Take a look at them, and we're gonna talk about them in the next slide. So, what is the diagnosis? Cardiac tamponade due to malignant pericardial effusion. The physical exam triad classic for this condition is going to be Beck's Triad, hypertension, distended neck veins, and muffled heart sounds. We see them all in this case. And the pathophysiological mechanism leading to the hypertension in this patient is pericardial fluid compressing the heart, resulting into a lower ventricle filling, less stroke volume, and lower cardiac output. Also, ECG is also showing electrical alternans, and the most appropriate next step for management is going to be urgent pericardiocentesis, preferably ultrasound guided, and the etiology of the tamponade in this case is going to be malignant pericardial effusion with secondary to metastatic breast cancer. Here's also a last slide for the Beck's Triad. Take note, hypertension, muffled heart sounds, JVD, you got that. Beck's Triad. Now, if you guys like this very short clip, let me know in the comments. Make sure to like and subscribe, and I'll see you guys in the next video.